Good evening, and thank you so much for joining us on yet another episode of your health show. My name is Purity Museo. A total of 1.5 million people died from TB in 2020, including 214,000 people with HIV. Worldwide, TB is the 13th leading cause of death and the second leading infectious killer after COVID-19. That's according to the World Health Organization. Today, we talk about TB ahead of the World TB Day celebrations. And of course, the day is to raise public awareness about the devastating health and social and economic consequences of TB and to step up efforts to end the global TB epidemic. We talk with Dr. Stephen Wanjala this evening, and he'll be telling us some of the important milestones made. So far, are we celebrating, or still we have a long way to go as a country? Welcome to the show, sir. It's great to have you this evening.
Thank you, Purity. So I think we've made quite a bit of progress. So there is something to celebrate. We have newer, shorter treatments for both drug-sensitive and drug-resistant TB. So long time TB was being treated for more than 12 months. Now we have treatments that last 6 months, which are fairly safe for most people.
Yeah.
We've also, I think as a country, made some progress towards getting more of reducing the incidence. The incidence is like the new TB cases.
Yeah.
So we are expecting there are milestones that the world has set for itself, and for the year 2020 as a country, Kenya achieved its goal of reducing the number of new TB cases. There are still gaps, of course. We're still missing cases. A study that was done by the Ministry of Health in 2016 showed that we are missing about 40% of our TB cases. So 2020, for example, the country was expected to report about 139,000 TB cases. But we are only able to report about 72,000, I think, around 72,000.
Is it because of people not coming out, or what could be the gap?
Yeah, so there are multiple reasons, because TB presents very much like many other respiratory illnesses. It's just cough, a fever, a bit of weight loss. So some of the reasons is people take time to come. You'll see that about a quarter of the people go to, actually not a quarter, but nearly half of the people go to private sector first. And sometimes it takes a bit of time before we get to the diagnosis of TB. There are also a few people who have symptoms, but they just remain with them at home. And so I think this is one of the biggest gaps that we have to address as a country, to find those cases that are missing.
And when you talk about finding the missing cases, you've also mentioned that people staying home with the symptoms and are not seeking treatment. What do you think could be the possible reason for this? Is it because of the stigma that we see against our TB patients?
So stigma still plays a bit of a part. I think I remember a story that we were dealing with just a few weeks ago, actually, of a gentleman who was deported from a certain country because a Kenyan, that is, who had gone seeking employment, who was deported because their chest X-ray suggested that they have TB. There are also many other cases in Kenya that we can point to that highlight the fact that stigma is still, in fact, a problem. That could be one of the reasons. But I think a more common reason really is that many people who suffer TB still need to continue working. And TB requires that you take treatment every day, and many times people feel, okay, maybe I can't go to the hospital every single day to very often to take medicine. So this might also be one of the contributors. But also some other contributors is that some populations, I'll single out men, sometimes take quite a long time before they seek care, because now the cough is just usual cough, so it's often dismissed for quite some time before they seek care.
Yeah. In the country, are we seeing a decrease, a decline with as far as burden is concerned, or we are still seeing more cases of TB?
We still have quite a huge burden of TB. In 2020, I think we estimated to have about 139,000 cases of TB, and the deaths in Kenya were estimated at around 33,000. Maybe to break that down a little bit, that would mean every single day there's 90 people dying from TB. Maybe to even make it more practical, that even the mama mboga who maybe has not gone to school can understand, it would mean a bus of 60-seater bus crashing every day, and another one of 30-seater crashing every day.
So how best can this be addressed? And to join that point, COVID-19 response, has it by any chance affected treatment for TB patients, or even response to the burden in the country?
So COVID-19 came with its challenges and its blessings for TB, for the TB fraternity. I think the biggest challenge is COVID came with a lot of stigma, especially at the beginning. I remember I was in a supermarket and I coughed and people literally ran from me. And at the beginning, you know, our response as a country was quite, I would say, putting people off in a way. I mean, if you're going to be locked up in a quarantine center for at least a month or something, then people were really afraid to come to hospital at that time with anything that looked like a cough.
How exactly do you think this gap, so that we don't see 90 people dying every single day, okay, how do we close that gap?
One really important step is the finding of the cases, diagnosing cases. That's where that's where we have to begin. And I think we all have a responsibility, not just as a government, but we have responsibilities as individual Kenyans to help in that process of finding cases. And how you can help, somebody can help as an individual is if they have symptoms, they seek care in the right places. TB testing is free in all government facilities. So if somebody presents to those facilities, then they can be tested for free. That's one thing. The second thing that we have as a responsibility is for us to, if I see my friend, brother, sister, workmate coughing, I have that responsibility to encourage them, why don't you go get tested for TB and other things, then that way we prevent onward transmission.
What is TB and what causes it?
So TB is an infection. It's an infection that can affect literally any part of the human body, except parts of our body which are more or less or literally, they don't have a lot of blood supply. So the hair, the teeth, the nails are the only parts which we say cannot be affected by TB. But everything else, from the skin,
Yeah.
the muscle tissue, the eyes, the chest, the bones, everything else, the brain can be affected by TB. The most common form of TB we see is the TB of the lungs, which we call pulmonary TB. The others which are not in the lung, we call those extrapulmonary. Extra just means outside the chest. Yeah. So about majority of our TB cases are going to be pulmonary TB.
Yeah.
These are the people who can transmit also, because somebody who has TB in their bones cannot transmit, because TB is transmitted through droplets which you cough into the air, and then the next person breathes those in, and that's how they catch TB. And it's caused by a bacteria called Mycobacteria tuberculosis. I think maybe I want to touch a bit on latent and active TB.
Yeah.
So when you get exposed to the TB bacteria, and it goes into your body immune system tries to fight it. And if it's strong enough at that point, it can sort of, I think I'll use the example of a prison. Yeah, your immune system is like the police system of your body, and is able to catch the TB bacteria and put it in a prison somewhere in your body.
Yeah.
But they don't kill it completely. So, but they are able to contain it in that small prison for some time, until a point when your immunity drops and they are no longer able to fight very well. And so the bacteria leave that small prison that they were staying in, and now they can multiply. So that period where your body has sort of put the bacteria in some small prison, that's latent TB.
Okay.
You don't have any symptoms, you don't look sick, you don't have any cough, you don't have any fever.
And it can disappear.
But it's inside you. The
Okay.
TB is inside you. Sitting in a prison waiting for your soldiers to be weak, the immunity to drop. And that is where things like HIV come in. Because HIV, as it progresses, will reduce your immunity.
Yeah.
And so that latent TB
will now be active. Yeah.
So active TB is when you have the bacteria in your body and you have symptoms that we can see. You're coughing, you're losing weight, you're having a lot of night sweats, having chest pain if it's in the chest. And that's now what we call active TB.
Yeah. Maybe you can go on with the symptoms. So
maybe I'll talk just a bit more about latent TB.
Okay.
The reason is 1 in every 4 persons in the world has latent TB. It can be higher in regions like Africa and Asia, where TB is much more common. And the reason why I want to highlight that is that there's one more thing we can do as an individual to help in this fight, which is to go and get treatment for latent TB if you are at high risk. For example, health workers like me, it is actually 8 people in every, out of 10 healthcare workers, 8 have latent TB because healthcare workers get exposed a lot.
So how do you know that you have it?
So there are tests that can be done to help to look for latent TB, to look for your body's reaction. But these are not necessarily needed to give you that treatment.
Yeah.
For healthcare workers like me, because 8 out of 10 times you will be right if you just give me the treatment for latent TB, then you can actually just go ahead and give me the treatment for latent TB.
I know you mentioned people with low immunity, such as children. Yeah. Do we have another group of people who are at a risk of TB?
Yeah, so low immunity covers quite a number of people.
Yeah.
So I'll mention some of those. So children typically have a lower immunity. Then we have people living with HIV. Like in Kenya, you'll see that 1 in every 4 of our TB patients has HIV. And this is mostly because of just the reactivation that we talked about. The malnutrition, I think, is a big one, and this affects also children, but also adults, where we'll call it undernutrition. So you're not eating well, and then because of that, your immunity is not really up to speed. Smoking also is associated with TB. So because generally they'll have a bit of lung damage, and also that also affects how the immunity works. People with diabetes have a slightly increased risk because also that causes a bit of dysfunction also in the immunity. Pregnant women. Pregnancy in itself is a condition that lowers your immunity a bit. So, and then now not related to immunity is people who live in congregate settings like prisons, where people are very close. I think COVID helped to highlight the concept of physical distancing, which helps also to reduce transmission of some airborne diseases.
Yeah.
And then, I think we can go with those, right?
Yeah. Yeah. And the risk factors for TB, you said, it's about the immunity. Okay.
So first, everybody is at risk of TB.
Yeah.
And that's why I think the conversation around latent TB is important, because if your immunity is high, you still get TB. Doesn't mean you don't get TB.
Yeah.
It's just that your immunity is able to fight it and keep it in a latent phase.
What are some of the possible complications if TB is detected late, or even someone doesn't even seek any treatment options? What could be the complications that may come with the early signs? People should seek treatment because TB is curable. Yeah. I think that's the first message that we would like to get out. TB is curable, so come seek treatment. You will get cured if you seek treatment early. If you don't seek treatment early, the worst that could happen, which we pray doesn't happen to anyone, is that you end up dead. And that's really one of the things we're trying to prevent by getting people diagnosed early and started on treatment early. Yeah. Then the other complications, if you start treatment late, what that means also is that you might have allowed the disease to damage your lungs quite a bit. So then you end up with post-TB lung complications, you know. Yeah. So you end up with chronic lung problems because of the damage that the bacteria left in your lungs. So I think it's important to seek treatment early so that we can avoid this kind of complications. Right. The other thing is it's not really a complication, but it's a social problem. The social problem is that nearly 30% of our patients with TB, they face catastrophic costs. What that means is they have to sell a house, they have to sell property, and that kind of thing to be able to, foot the bill of having to go to hospital so frequently. So if you start treatment early, those costs are likely to be fewer. Yeah. Yeah. So what are some of the treatment options available for TB disease?
So TB, the majority of TB is treated in 6 months. It's tablets that you take, and this you are treated for 6 months, and for the majority of our patients, they're gonna get well. We have some more stubborn forms of TB we call multi-drug resistant TB, which are treated for 20 months. But the good thing is that all this treatment is also now oral pills. Before, for the multi-drug resistant TB, we used to use some very much more complex medications that required patients to be injected for a whole year. And if you can imagine being injected for a whole year, I mean, you run out of places to be injected at some point. So I think this is one of the really good developments that we've seen in the TB world, that now for multi-drug resistant TB or drug-resistant TB, we have treatments that are oral and that are safer than the treatments that we used in the past. And we have seen that more patients are finishing their treatment now because the treatments are more friendly.
Yeah.
Yeah.
Okay. And as we wind up, take us through the preventive measures. How do we prevent TB from either spreading or even protecting ourselves and our loved ones from this disease?
So the first thing is cough etiquette. So cough etiquette is really important. COVID has really helped us to put that message out. If you cough into the shallow of your elbow, wash your hands. Now we are using, and I'll borrow this from COVID, face masks I think are helping us. I do believe they are helping us in a way. We used to use them for MDR patients or drug-resistant patients, but now everybody is wearing. The other thing that we can do is, if you have a cough, seek medical advice on time, early, and this will help you to be diagnosed early and prevent you from transmitting to other people. That is also prevention. And then other measures like keeping your house ventilated. So we see, for example, in some of our rural areas, we still build houses with very small windows. So keeping your house ventilated and keeping those windows open.
Okay.
Yeah.
I think that would be all.
All right.
Thank you so much, Dr. Stephen Wanjala from the Center for Health Solutions. I hope I got that right.
Yes.
Thank you so much. It's always a great pleasure having you and talking about TB and raising concern about actually something that I had not even thought about, latent TB. So to our viewers, please remember to always exercise cough etiquette and seek treatment as soon as you begin having some of these symptoms, and so that we can all fight TB. I'm Purity Musea. Thank you for watching Your Health Show. I'll see you again next week, same time. Enjoy the rest of your viewing, and God bless.